Good afternoon, everyone. Today, this November 1st onwards, our schools are all going to reopen. All kids go starting their schools again, so they are meeting their friends, their teachers directly. So in this pandemic time, what all things we want to take care of? We have Dr. Nitya ma'am here. So I would like to invite our Nitya ma'am for giving the wonderful info, sharing the wonderful information and all. It will be helpful for us as a parent, as a teacher, as a students. It will be very helpful for us. So I would like to invite Dr. Nitya ma'am for giving or sharing her knowledge. Thank you, Nitya ma'am. I'm welcoming you to the session. Myself, Girja Peter. I am the Circle Coordinator and Faculty of National Child Development Council.
Thank you, Girija ma'am.
Nitya ma'am, you can introduce yourself also.
Okay,
ma'am.
thank you. So thank you, Girija ma'am. At the outset, let me thank the organizers for giving me this opportunity here to share some of the medical information regarding COVID as well as its impact. And as Girija ma'am said, the school reopening, we are right at the, we are at the footstep of that. So let me request the audience to please mute the video so that our talk we can go smoothly. And I would like to make this actually an interactive session. It's like not just a one-sided talk. I do understand that a one-sided talk in Sunday afternoon it's very boring. So we'll make it an interactive session. I'll share whatever information I have collected, and I'm sure you will be having a lot of experience regarding online and offline teaching for the past one and a half, 2 years, which we are dealing with. So you can share information from your part. We'll have a discussion, and at the end of the day, I think we should have a fruitful discussion with some of the information we have to carry home. Okay. So let me try sharing the screen, ma'am.
Yes, I already allowed.
Okay, thank you. Am I audible? Is it clear?
Yes, audible.
Okay,
Audible.
fine. Is it visible, ma'am?
Yes.
Yeah, thank you so much. So, so I'm interested in the duty of delivering a talk on school reopening as well as precautions for kids this year. So, right from tomorrow, we have a new beginning actually. Myself, I'm Dr. Nitya. I'm a consultant pediatrician at Jubilee Mission Medical College, Thrissur. We'll move on to the topics which we are supposed to cover for the day. I'll be discussing it under 3 headings. First will be actually COVID-19 itself in children, the disease pattern as well as the prevention. Then what are the impacts of COVID-19 apart from the medical side? What are the different areas affected or probably which we had to modify thanks to COVID-19 in the past 2 years? And then, of course, our topic, school reopening, the next big step. So, as we all know, COVID-19 is actually nothing but a coronavirus. It's a respiratory virus, which is supposed to be originated from Wuhan in China in October-November 2019. And later on, it spread to different parts of the world, where by March 2020, it was declared as a pandemic by WHO. Basically, when you look at the data of COVID-19 in children, it's very evident from this graph that the percentage of children affected or a severe infection in children is actually much less. So it's a known fact, as we all know, COVID-19 has its biggest impact in the adults. So initially we were told that we have to be careful about our senior citizens where the extremes of age can be the problem. Then later on, during the second wave, more of adults, young adults were affected. But somehow the incidence as well as the severity of infection of COVID-19 in children remained less. And quite a few reasons were hypothesized for this. So in children, most of the infection goes as mild or asymptomatic. Asymptomatic we call when there are no much symptoms for the infection. So mild infection in mostly 90 to 95%. 5% might require hospital admission, that too for not very severe infection, maybe because of the comorbid reasons. And 1% can have severe disease. And why this change? Why there is COVID-19 such a, it's a killer, as we all know. Such a disastrous disease behaves very mildly in children. Quite a few hypotheses are there. It's maybe kids, the way it enters the kids and it acts on a particular enzyme called angiotensin converting enzyme. So that receptor actually is not well developed in kids. That is one hypothesis. The kids' immunity is actually it's not exactly like adults, because kids are more prone to other diseases. They're just finished their immunization. Though for the other vaccines which they have already received must have modified their immunity, and a lot of similar factors. So similar things must have um, made COVID-19 illness a less severe infection in kids. But again, we do have children affected with COVID-19. They'll have a kind of respiratory, some amount of cold, running nose and cold and fever. But initially, as we all thought, that kids were actually, though they have they don't have severe manifestation, they can act as good spreaders of the infection. And that is why all the kids were asked to be inside the home. That's why we all asked them to that's why the health authorities asked us to keep them inside the home, so that when they go out and get the infection, they won't spread it to a lot of people. So they have the ability to harbor the COVID-19 virus longer time, even though they are not symptomatic. And this will actually infect others. When adults get infected, that will be more disastrous, and that can lead to several complications. So that is why initially the whole world went into a state of lockdown, as we all know. So when we recollect the events, it started from December 2019. We all know that step by step we went into lockdown, and that is especially for kids as well as the two extremes of age, kids and the older persons. So the kids were actually asked to stay inside just because of this reason, because they acted as super spreaders. Now, how will COVID-19 manifest in children? So as we all know, most of our families must have, or some of our families must have got already affected with COVID-19, and they'll be knowing. But whatever said, actually a kid affected with COVID-19 or COVID illness is actually it's actually a matter of stress for the family. Since we all know they'll tell it's a child, so we don't know how it behaves. Will it cause pneumonia and all those stuff? Lot of questions we do get. So usually the common symptoms what we see are fever, cough, as we get in a common cold. We all know how we get a common cold. So there'll be fever, cough, rhinitis, bit of sneezing, running nose, sometimes sore throat, and fatigue. Fatigue means tiredness. They'll be tired, as in any case of viral fever. They won't be feeling like playing. They want to sleep all the time. They'll be sleepy, tired. They won't feed as how much they were feeding before the illness. And then some of the kids, if actually it goes into a pneumonia kind of thing, they can develop breathlessness or shortness of breath. They can have myalgia, muscle pain, a bit of pain while they move and all. Some of them present with diarrhea, some of them with vomiting, and classically, as we say in adults, a few percent presents with loss of taste and loss of smell. So these are the common symptoms we already know about, which have been seen in children with COVID. But do we need to really be cautious when a child gets COVID? Actually, as I mentioned, it goes off like any normal viral upper respiratory or just a common cold infection. But some group of kids whom we have to be very, very much careful about are those at risk. That means those having a congenital heart disease, those having underlying other diseases, especially congenital heart disease by birth. And then those having chronic diseases like kidney disease, chronic liver disease, those having protein energy malnutrition. So as you all know, what protein energy malnutrition is, that is basically uh, the state where the child is deficient in the required energy in the form of proteins or carbohydrates or whatever. So child with severe protein energy malnutrition is definitely at a risk of developing a complicated COVID. Immunocompromised, that means a child whose immunity is the power to fight the diseases. So child whose immunity is compromised, either in the form of congenital diseases, by birth they have some amount of immunodeficiencies, we call primary immunodeficiencies, or maybe some acquired causes, some acquired diseases which can cause immunocompromised state. Then children on chronic treatment, especially those on chemotherapy, those on long-term steroids, and finally, a group obesity, where severe obesity is actually a big risk factor for developing a complicated COVID illness. Now, coming to treatment, I would request all of you to interrupt me in between. I don't bother about that. Please interrupt and ask questions if you have doubts, or maybe we can have a question answer session at the end. Since it's an online thing, it's like it's difficult for me to understand whether people are with me, you're following things. But if anything, just raise hand or can even unmute and ask a question, no issues.
Sure, ma'am.
Yeah, thank you. So coming to the treatment, we have basically the treatment of COVID-19 is very simple. Treatment of COVID in children, it is just supportive. So what the child has, just treat it. If the child has fever, give symptomatic treatment for fever, that is our well-known paracetamol syrup. If the child has running nose, treat running nose, nose block, treat nose block, that's all. But equally important is something which we usually don't care much about when the child is sick. That is actually hydration. So hydration is giving him water or fluids, any form of fluids, as much as he can drink. This is important because that again strengthens immunity. Hydration improves the clearance of the organism from the respiratory pathway. So if the as we know, the organism, it's not just regarding COVID, it's about any respiratory, any organism causing a respiratory illness that harbors in the nose and the tonsil and the throat and mouth. So what happens if there is no hydration? That keeps on sticking there. It won't. Our nasal mucosa or throat mucosa won't be able to throw it out. So for that, for the mucosa, and we have some hair kind of things and all called cilia. So for these things to work, we need to have good hydration. So that's why whenever a child comes to our OPD, we tell them you should have proper hydration, especially when there is fever. Fever, as you know, it's a state of elevated temperature that will again further cause dehydration. So again, hydration is very, very important in each case. So along with treatment of fever, hydration, and of course, good nutritious diet. I'm sure the child will not be he'll refuse to eat during the days of fever, but whatever possible in small, frequent quantities, we are supposed to give him. Along with that, the guidelines say we can give multivitamins, especially zinc and vitamin C, which can again boost our immunity, so that the period or duration of illness will be less and the child comes out of it well. So that is regarding treatment of COVID. What we'll do if we have a child at home and somebody else gets COVID? This also, I'm sure that most of our family must have got or must have experienced it. And it's just a revision. I just put it because if somebody is not yet exposed to COVID-19, I think they can practice it. So if somebody is at home isolation, children can wear mask. As we know, children will go to each and every person at home. So children are potential carriers, so that the disease can be carried from this person to maybe an elderly person, grandparents or somebody, or maybe who's chronically sick. So in that condition, in that context, we ask them, it's always better to isolate each and every one of them. So when we isolate a person who is sick, we call it quarantine. When we isolate a person who is prone to get disease or who's at risk of developing disease, we call it reverse quarantine. So actually, most of our families, as I told, must have practiced this. So quarantine and reverse quarantine, both should happen at home. And again, our SMS, so hand washing, use different plates, use different common, don't use common objects for uh, those diseased and not, those are not diseased, and other, again, sanitation, disinfection and all. So that's regarding COVID contacts. Coming to danger signs, when should we be alerted, or when should we think of taking the child to a hospital, or when should we think of think that the child is sick? So there are some danger signs or red flag signs, as we say, and it could be several things. So one could be child is lethargic. Uh, During fever, what usually happens is during fever they'll be sick, and once the fever is down, once the temperature is normal, they'll start walking around, they'll start playing, they'll start eating and all. But if the child is continuously lethargic, continuously sleepy, and continuously lying down, not getting up, then that is actually a danger sign. And similarly, if the child is having high fever continuously, so usually viral fevers, as we know, they might last for 5 days. Some of the present fevers, they last till 7 days. So, but still, in between fever, that we have a fever-free interval. If that is not happening, the child is having continuous fevers, or the fever is lasting for more than 5 days, that should be taken as an alarming sign. So that point, it's always better to consult a doctor. Other signs like severe headache, severe uh, cough, breathing difficulty, when you find there is fast breathing, or when there is increased work of breathing as in the form of retractions. So mother can find some amount of chest retractions while breathing. And as in the first picture, in this picture, a bluish discoloration of lips. So all these are ominous signs where you can't wait, can't keep the child at home, should be taken to hospital. Coming to another important, a very, very important complication of MISC, of COVID, it's called MISC. MISC is nothing but multi-inflammatory syndrome in COVID. So actually, as I mentioned, COVID per se is actually not very, very dangerous in kids. It goes off as a small infection. It goes off as a simple viral infection or a fever and running nose. But what we commonly see, we do get cases, even now we are getting children who develops fever and a similar kind of illness after COVID. So they become febrile, they do recover from COVID, they are back to normal. Around 1 month later, up to 3 months, they can develop fever, which is high grade fever, continuous fever, associated with a rash in the body. You can see from this picture, you can appreciate a rash. This kind of reddish patches or papules over the body, with some amount of eye congestion, with some amount of oral, that means, redness in the mouth. They can have diarrhea, they can have breathing difficulty, and they can also have swelling of limbs, so swelling of hands and feet. So this condition is actually very, very dangerous. This is actually one of the severe complications what we commonly see in children. And I would like to tell you one more thing, that this is commonly seen in kids who have a mild COVID infection. So typical scenario will be like this. Parents had fever, they were positive, they were tested positive. Kid had just 1 day fever, or just a feverish, that's all. Not even documented fever. He was all right, he was running around, and 2 3 days, a bit of sneezing, that's all. 2 3 days he was running. Okay, nobody tested, because kids, we don't take them to test. Nobody tested. This kid, exactly after a month developed high grade fever, went to different 2 3 hospitals, treated for several infection, urinary infection, respiratory infection, nothing happened, given multiple antibiotics, and then came to then will come to a hospital. Our hospital being a tertiary center, we do get similar cases. So there what happens is, uh, this child has not been tested for COVID, and definitely parents will not be agreeing to agreeing that the child had COVID. So whenever we ask them a history of COVID, they say no COVID, nothing happened. But when we ask them in detail, they'll come up that parents were tested positive that time. Child had a mild infection which we didn't even bother to check. So this is a typical scenario: a mild infection or even asymptomatic kids after 1.5 months come back with fever, and this child, if not treated with the so-called treatment, that is what we call as IVIG, intravenous immunoglobulin, and with or without steroids, the child will go into cardiac failure, cardiac dysfunction. And that is actually, we had around, if I'm sure the data shows, around 3 to 4 deaths in Kerala state in the last 1 year. It's just because, it's not because it's not treatable, it's because we it's because the diagnosis was missed, because it's a really new phenomenon for all the doctors. So it's very difficult to pick up. Unless we think about it, we can't pick up. So this is something which I wanted to I know I've spent a couple of minutes talking on this, because this is probably one thing which I wanted to share to you people, so that you can make awareness regarding this, maybe to teachers and parents, whoever come up. Because still we know that still we get a COVID positive illness in the families, but and we get kids affected with COVID, and these kids can later develop something called MISE, which should not be missed. So coming to the waves of COVID, as we know, we all know, started with the first wave in the last March, then again second wave. So everybody was waiting for the third wave. We don't know third wave has happened, or it's come down or not. So as in any pandemic, pandemics occurs in waves. So this is the typical pattern of how pandemics go, starting from the Spanish flu in 1918s and all. So again, first wave will be smaller ones, second and third might be bigger ones, and then slowly the waves will die off. When will the waves die off? It usually dies off when, as we all heard of herd immunity, when the population is, when most of the population is immune to the disease. So this is actually when there is no herd immunity. So this is a diseased person, he spreads the disease to several people. When there is herd immunity, in the diagram, those who are in yellow are having herd immunity. Immunity. The immunity to the disease can be either because of vaccination, as we have already done with adults, or can be because of those who have already got the disease. So natural infection or vaccination, either of this can give immunity. And this immunity will protect the people outside the ring, so that this immunity will take care of the diseased person and will make sure that he won't spread it to others. So we are waiting for such a point where we reach a herd immunity, so that in between, if somebody gets positive in between, that will stay in within himself, or maybe 2 3 people, not more than that. So that is what we are aiming for. And apparently the recent statistics show that around 80% are having immunity, according to, I think it's a study done in Trivandrum. According to the in adult population, around 80% are having natural as well as vaccine immunity due to vaccination, and around 40% of kids are immune till time. And basically, we know the different peaks are because of, we have heard of Delta variant, Delta plus variant of COVID and all. It's basically because of genetic mutation, as well as when our people, they forget the basic practice of SMS. So these two are the reasons which cause the waves to come back again and again. And maybe a couple of months back, it has started that the next wave will hit kids, because as I told, initially the older people were affected, then slowly the age of affecting it's come down to adults, younger adults, adolescents, and probably the next set of patients affected will be kids, and that's why our government had hiked up all the precautionary mechanisms for treating as well as preventing COVID in children. It's just and one more reason which can add on to it is that children, the vaccination children is yet to come up, as well as they are not. I mean, when they get exposed to outside, because for the past 1.5 years they are inside the house. So when they get exposed to the outside world, they can have more of incidents of COVID infection. So as we all know, prevention is definitely better than cure. Catch them young and teach them young. So I just put this slide because you have to teach them. We have to uh, give them an idea, give them the basic idea of SMS right from the beginning, so that it's difficult for all of us to um, learn and practice a new thing. If it is there right from the beginning, as what we call, if it's one of our habits, it will go on like that. So make it a habit. SMS should be the habit. Of course, avoid unnecessary travels. Um, we all know that since it's a law, the unlock 1 2 has come up, we do find several kids out of our homes and houses, and they've been traveling. So please avoid unnecessary travels, and then make it as our social responsibility. Coming to immunization, yes, immunization actually, this I've mentioned about routine immunization. For in the name of COVID-19, we are not supposed to miss out the immunizations. Continue immunize the child with all the vaccines available, at least the mandatory vaccines stated by the government. It's because, as I mentioned, when a child is getting immunization every year, or the first primary series and then followed by boosters, his immunity will have some amount of will have some difference compared to adult. An adult must have received immunization maybe 10, 15, 20 years back. So his immune cells will be maybe taking rest. But in a child, when he's in a state of receiving immunization every year or the other, so his immune cells are more fresh, they're more alert. So that might be one reason, as I mentioned, child is COVID infection as such is not very harmful in children. And regarding COVID-19 vaccines, we all know several studies are going on. Very soon, they will come up with vaccines in children. And as we know, Covaxin studies being done, phase 3 trials going on. Again, Zycov-D is another vaccine which is coming up in children more than 12 years in India. Yesterday, Pfizer vaccine has been approved by Food and Drug Administration, FDA, for use in children in US in 6 to 11 years. So I think more of hope coming from that side. So regarding that first session, so that finishes our first session. Shall we stop for discussion, or we'll go on? I think we'll move on.
We can continue, ma'am.
Oh, okay, fine. So this is so the next session I'll be dealing about how COVID-19 has affected the life of our children. Okay. So this is basically how we can ask them to lead a healthy life during pandemic. Now we are almost maybe on the slope of pandemic. So mostly it's a dying out slope of pandemic. But the last 1.5 years, what has been there with the kids, we'll see. Shall I request the audience to mute if? Okay, thank you so much. And the first and foremost thing will be regarding diet. I'm sure I'm getting a lot of children in my OPD since last 1.5 years, they are at home. They don't have that usually when schools are open, usually they have a fixed timetable, even school on school days as well as on non-school days. Since lockdown has happened, I'm sure that most of the families, they don't have uh, they lack a proper timetable, maybe a less disciplined life, and they usually they don't have fixed time for breakfast, lunch, and dinner. And as part of it, the diet becomes erratic, and most of them will must have forgotten what is a balanced diet. They have started eating junks, that too at untimely intervals. So all these things have caused quite a few problems. So a balanced diet is needed to avoid these two conditions. So you can see at one end of spectrum, we have a protein energy malnutrition child. It's a PM child. But fortunately, we don't get to see such children in Kerala in the recent years. But look at the other end of the spectrum. This is actually the coming up form of malnutrition, or probably the recent emerging form of malnutrition of our modern world. It's nothing but obesity. So even at your own house or our own places, when we look at you can just look at the weight of the kids during the pre-COVID era, and maybe you can check now. Definitely, weight gain will be significant. So we very commonly we get children who have gained at least 10 to 15 kgs during the lockdown. It is it's it may be because of different reasons, several reasons, because uh, one, they might be having frequent intervals of food. They might be having different types of food, because that initial food pattern will be almost similar when you go to school. That time it will be almost similar, but in at home we don't have a regular pattern, so we'll just eat whatever we get. And most of the time they are bored, so during the time of boredom they'll just eat to make them uh, to keep them busy. So all these things, and again, lack of exercise. Most of the parents, they still believe that playing outside the house will get and children will get COVID infection from outside. So most of them, they don't leave the kids to play outside. They might take the kids to the malls and shopping malls and beach, but playing leaving them to play outside, still they believe that they would get corona and come home. So that is lack of exercise, a shattered food pattern, and a shattered food timing. All this must have led to the incidence of obesity. So I would suggest, as I know I'm addressing a panel of teachers, so probably this is something which we have to uh, stress when we teach them, especially the lower classes. So get them into the head the idea of eating healthy. And eating healthy, you can teach them in two different peaks. So this is actually a food pyramid. I'm sure all of you will be knowing about food pyramid, where the base is actually what is our staple food, usually cereals, so rice, wheat, or whatever. An equal amount should be contributed by fruits and vegetables, maybe a lesser percent, 10 to 20% by proteins, milk and meat group, and still lesser percent, a 5 to 8% by fat containing food. So this is the food pyramid which we all have to be aware of, and we should be all conveying this to parents and kids. Again, we all know a big no to junk food, especially when there is no exercise, when you are not going out, more times of junk food. We have the online food delivery system now, so it's very easy to get. So a big no, that's it. And this is from Indian Academy of Pediatrics, where the junk is actually an acronym of these five. They just don't include burgers and pizzas. So they include junk foods, as we all know. J for junk, U for ultra processed foods. Processed foods quite oftenly we see in all the shops. Nutritionally inappropriate foods, and caffeinated, colored, carbonated beverages. So all the caffeinated and carbonated beverages, and sugar sweetened beverages. So as we all know, high fructose is actually it's actually a slow killer. And we all know that refined food, the more the refined the food is, the more harmful is it to the body. So that's how we have to classify the food and tell them that these are all not to be taken regularly, or you can even say a no to. So what I usually advise is, you just try to refrain this from these food for 2 to 3 weeks, and let us see what's happening at the end of 3 weeks. 3 weeks you are happy, then yes, then he or she is into the stream. If still maybe if you give an option to them for to do it once a week, obviously they'll bargain and do it more. So you ask them for a challenge, I would say. For the next visit, when he or she comes, he should tell me how many times he has taken junk, and maybe you can give a small reward for not taking the junk food quite frequently. And yes, so if it is no to junk food, what for yes? Yes is to what we call as VIBGR diet, where the diet should contain green, yellow, orange, and red fruits and vegetables. So this is something which we can train them how to uh, choose their food. Again, as I mentioned, the daily routine it was not there. So which was there in the pre-COVID era, it's lost. So that itself, they'll have late night awakening sessions. They will sleep throughout the day. They usually get up by 12 o'clock in the afternoon. Uh, they'll miss the breakfast. They'll have a brunch or something like that, and then it goes on like that. And most of them, they come with sleeplessness, or rather they feel more sleepy during the time. They're not able to concentrate, they have a headache. And another important thing is what I've commonly seen is gastritis. Most of the kids have gastritis these days. Whenever they eat a small spicy thing, or a fried item, they'll get gastritis, vomiting and all. And when we ask the history, they'll give you the same history. I miss meals in between. I won't sleep for longer time. I'll be watching TV in the night, all the stuff, or mobiles in the night. So that is something which we commonly see nowadays. Maybe school reopening might uh, help us to at least help to come down all these issues. So coming to screen time, as we all know now, from the pre-COVID era, now we have moved to an era of screens, mobiles, and gadgets. So previously we used to tell them not to use a screen. Now parents have to tell them. So use the screen for for studying. Use the screen to view your notes, you view your class. We have online as well as offline. I mean, notes coming in the mobiles. So according to American Academy of Pediatrics, the screen time guidelines is actually less than 18 months, no screen time at all. 18 months to 2 years, again, little or no screen time. If at all they're watching something, that should be co-watching, that is, they should be watching along with adult, with only if it's a high quality educational content. So less than 2 years, practically no screen time. Now 3 to 5 years, up to 1 hour per day can be permitted. But again, co-watch to help the kids understand what they are viewing and choose an interactive media. 6 to 10 years, around 1.5 hours. Limits time on the screen, and it should not be just before you go to sleep. It should not precede the sleeping time, or it should not be during eating. So that's a common thing. Whenever we want to feed the child, you keep the mobile or TV on and feed the child. So neither he knows what he's eating, neither we know what we are giving. So that is regarding this screen time, and 11 to 13 years up to 2 hours. So this guidelines was put forward for non-academic screen times. Academic screen times, we know, since it's an online classes going on, we have no other go. So we have classes for 3 to 4 hours a day. But this is basically for non-academic screen time. And as I mentioned, online classes, 5 golden rules, I would say. It's the time, as we know, it's around 3 to 4 hours a day. But in between, I'm sure in between, we have breaks, around 10 to 15 minutes break for all the schools. The size of screen is very important. The smaller the screen, the more complications for the eye. So I would advise you to tell them that the screen should be at least as big as a laptop or a computer, if possible. If not possible, a tablet. Still not possible, only mobile. So the bigger screen is always good. And the distance from the screen. Now we see when the kids look at the mobile, they'll keep the mobile like this and look, which is actually not which very close to the face and look. It's actually not at all good for the eyes. So the distance from the screen, you should be telling them, and you should be intermittently reminding them also. This should be the distance where you have to sit. It should be a well lit room, and they can be asked to relax the eyes. Actually, when our eyes are most relaxed when we look to the father's position. So in between the classes, you can ask them to, or maybe soon after classes are over, you can ask them to go out and look at the sky. So the farther, the more distant you look, the more relaxed your eyes are. So relaxation of eyes, they can actually blink in between the classes, not just look continuously onto the screen. They can blink between the classes, and once the one period is over, they can go and wash the face and eyes with cold water. Then the brightness of the screen, yes, parents should be aware of the brightness of the screen. They should be adjusting it so that the brighter the screen, it will be more strain for the eyes. Again, posture. Some of our adolescent kids, they come with backache now. So when we take these rates, basically because of their posture during the classes, they have longer classes, so they'll be stooping and sitting, and they'll have backache. So ideal postures also should be advised. So these are regarding online classes. Though we are starting with offline classes from tomorrow, or school classroom tomorrow, I'm sure that a major portion has to be covered online only. So these are valid points even now. And these are the common practices what we see. See how close the child looks, and so see how bright it is. Even lights up the face of the kid. These are actually not good for a longer use. Coming to other gadgets, television, yes. As I mentioned, if you limit the time, they can be given an option of watching television, but surely not just news and serials, because we have been seeing. A month back, I had a boy who came and told me that, "Doctor, please don't tell me I'm having COVID. The moment I know I'm having COVID, I will die." So it's basically because he has been seeing all types of news, all types of COVID deaths, the data, statistics, everything, discussions, everything in the news along with his mother. And we really don't know how these people keep process this information and keep the things in their head, because the way they interpret will be very different. So then I had to counsel him. I had to speak to him around 10 to 15 minutes that COVID will not kill all people. Even COVID in children is actually not very severe. So that is the impact of news channels, and that is the impact of serials. So always give them gentle, useful information. Tell them about the environment, tell them about the world, tell them about our country, all the useful, gentle information you can tell. And of course, social media, as we all know, we all live with social media these days, and they also do have a great impact on kids. This is something which I would mention especially here, because I have a few participants here, but still each of you have to tell them to each family, because nowadays we are getting lot of psychological issues from the kids, starting from infant age, that means 1 year of age, to adolescence, a lot of psychological issues. So this is actually, we lack to spend a quality time with children. So make sure that you spend at least 30 minutes of quality time every day with your kids. So both parents may not be available. Who is available? One parent or grandparent. The whole family should sit together and talk together for 30 minutes at least. And that should be not about learning things or academic things. It should not be about the studies. It should not be about the homework. it's not just homework time. I do understand that most of the parents, they'll find time with the kids to sit only for homework because they are working. It should not be like that. So 30 minutes of quality time with children should be there, and this 30 minutes should have fun. They should have positive talks, appreciation. See, when they were having schools, they'll at least one of the teachers will tell a good girl, good boy. That itself is a good appreciation, but that won't happen at home. So this is, it's our duty as parents to appreciate them for little good things they do, listen and speak to them. And again, they can engage in indoor games, or again mingle with family members, especially older people. So this is something which I have to stress. Another important part which most of us forget, conveniently forget, is do exercise every day. So exercise, make it a habit of the family, not just the child. Only the child need not exercise, the whole family should exercise, so that it goes off as a part of our routine. And as we know, that definitely prevents obesity, which is actually the next killer. Probably it's a slow killer. It prevents the heart diseases maybe in the long run. It's also known to prevent osteoporosis, especially in girl children. When they do adequate exercise in the adolescent age, it is known to prevent or delay osteoporosis. Osteoporosis is nothing but thinning of bones, which happen when we uh, reach above 50 or 60 years. So that is the importance of exercise. Along with physical health, health is as important as that. That's what I mentioned. Now we are getting lot of psychosomatic illness. That means the child will not be having any physical illness per se, but the his or her mental stress, she will bring it out as a physical illness. So we had a child who was admitted with bilateral leg pain, knee, heel pain, I would say. They went to several hospitals, they went to several pediatricians, they went to several orthopedicians, multiple x-rays taken. Finally, some rare diagnoses were made. And finally, what happened is when we sat and talked to him, it was actually he had a lot to say, but there was nobody to listen to him. Day by day, when we talked to him more and more, his illness came down. At the end of 1 week, he was perfectly fine without any single injection or treatment, and was discharged. So that is exactly what is happening. We all know, we all are stressed. Mm, but it's our duty to make sure that the child should not be feeling isolated at home. So talk to him more frequently. We should listen to him. It's not just talking, we should listen to him also. They are all these kids are all brilliant brains with so many ideas, which they are not able to share with the friends because they are not even meeting their friends. So at least let them share it with the families. So don't make them not feel isolated, give them some time. And the stressed parents, of course, we know parents will be stressed because of many reasons. Their job reasons, their probably the income issues, uh, the work related issues, so many things. But please don't project on children. So we know, even we have the habit of doing it. When we are stressed, we'll ask them, we will project a portion of stress on the children, but please don't do that. And another important thing which is commonly reported is actually child abuse, because the child is at home throughout. More of child labor, child abuse, especially sexual abuse. So if at all something like that should be reported to parent, child should be asked to report to parents immediately, and should be reported to the concerned authority. And you all know child helpline number, and I'm sure you'll be knowing about it. It's 1098. So in short, when we have the kids at home for the time being, from tomorrow again school starts, but again I know it's this partial reopening of schools, still we do get them at home. So during this time, develop good habits in them, like reading. As we all know, we in our generation, when we were small, we have read a lot of things. So we didn't have any other opportunity like mobiles or other gadgets or social media. So reading, still it is actually the golden, um, what do you say, it's actually the best friend you can have. Teach him about environment, teaching about saving the environment, teaching about time management, teach him about the small homely things like cooking, teach him about small first aids which he or she can give. In total, teach him more of life skills. And I'm sure as a set of Montessori teachers, I need not tell anything about life skills to all you people. You'll be knowing much better than me. So this is actually a well-being plan, which is which consists of 6 steps. It should be kept in mind when you uh, when you approach or when you support a child. These things should be there. One is to connect with others, stay connected with others, no isolation, nothing. Stay connected with others either through electronic media or live. Create, that means improve his creativity. Set goals, can be just short term goals. By the end of today evening we'll be doing this much, that's all. No longer goals, short goals. Teach him self care, because that is also equally important. You care for others as well as self care. So about food, diet, sleep, exercise. Teach him about self awareness. He or she should know how to express emotions, to share and motivate others, and of course help others. So should be the well being plan which we we have to teach him while they grow up. So that is regarding the uh, life during pandemic. Now let me stop here. I'll just continue and finish it off, and then we'll discuss.
Yes, ma'am, you can continue.
Okay. So I'll move on to the third part. That is probably the topic of today's school reopening. As we all know, from an era of slate, we have actually pushed them to an era of electronic media, or probably a tablet or a mobile phone, thanks to COVID. So now it has come up to a time that slowly we can start bringing them back to school. At this time, what are the things which we have to which we have to take care of? So why was such a decision? So any new decision, we'll deal it in 3 waves: why, what, and how. Why was such a decision taken? Why should the schools reopen? As I mentioned, there are a lot of problems, medical and non-medical, associated with keeping the children locked at home. And as I medical issues we have mentioned, uh, dietary issues, other medical illness, then psychosocial more than that. So it's basically educating a child is not just lessons, as we all know. So lessons, yes, teachers may be able to give it through online and offline classes, but it's not just teaching them lessons. So it's actually a complete improvement of child, which will happen only if they are back to schools, because their social life, they'll miss a lot of the social life, their friends, their teachers, how they interact with others, all this. So for that, so the complete development of child is will not happen without schools, we all know. And why, even in the midst of COVID, so many people will ask. So the government body has they had conducted several studies, they had conducted several meetings, and then they've come to a conclusion that, as we mentioned, COVID in children per se is actually not a great severe disease. So they can pass it off as a normal respiratory infection, except for the condition of MISC. But even if we can make them aware, if we make the parents and teachers aware of MISC, yes, that also can be sought out. That also can be easily diagnosed and treated. So in such a situation, there is nothing big to prevent starting schools. That's why government had come up with such a guidelines. And so the next, that is why, that answer for why. And why, and the next question is what to do for that. Definitely, we have to create awareness among all the stakeholders, be it teachers, be it school management, be it parents and kids. So everybody should be aware of what is going to happen and what should be done at schools, and they should continue doing it so that it goes smoothly. And how to do is actually, again, with a stepwise approach. We already know, I'm sure you'll be all aware of about these things. We have several advisory boards, several guidelines based on for considering reopening of schools. We had central as well as state guidelines, again guidelines with guidelines of Indian Academy of Pediatrics as well. So I'll just quickly go through a few statements from the guidelines put forward by Ministry of Health and Family Welfare regarding the school reopening. So we all know there should be proper cleaning and sanitation facilities. In the school, we should have different task teams. Each team committed to manage a certain thing. It could be a one team can be based on the how to know to assist the sanitation facilities, how to monitor how it's going. One team on probably if one of the child develops COVID, how to manage it. So one team on probably the medical conditions of school, one team on administration. So each task team should be made and they should be given different tasks for the smooth functioning. A seating plan, as we all know, keeping the social distancing, or rather physical distancing, I would say, rather than social distancing, physical distancing in mind. One student per bench, or even more, maximum of 2 students per bench. That should be the criteria. Social distancing at the entry and exit points of school, and every school should have its own standard operating procedures based on guidelines from state or the center. So regarding each, what will we do if a child develops COVID? What will we do if during the time of interval, or what will we do during the time of a sports hour? So each thing should be well developed, and display signals and markings for enforcing the safety protocols. This is very important because children are always children. They will forget once they are into the classroom, once they see kids, they'll forget everything. They'll be waiting to interact with their friends as they did before the COVID era. So it's our duty to remind them at every step, SMS, 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 so that at least some amount of intermingling and disease spreading can be prevented. Staggering timetable, actually these parts you already know. I'll just put it up just as a part of my talk only. I will discuss more on medical aspects. Staggering timetable, because we don't want all the kids to come. So around 25% at a time. So different timetables for different kids. And as we know, school events, congregations meetings should not be encouraged. Only through virtual meetings should be encouraged, and no assemblies or sports hours, or even eating together should not be encouraged. Every child should come with the parents' or guardians' consent. And this is very important. High risk children, those children with chronic diseases like asthma or chronic renal kidney disease, and those who are disabled, children on chronic steroids or immunosuppressing drugs, should consult their pediatricians before joining. So what we tell them is, you can wait for some more time. You've already waited for 1.5 years. You can wait for some more time till the things get settled, and then you can go and start joining the school. And all adult members should be vaccinated. Now, again, sensitize all students, parents, teachers, community members, everybody about their role. So there are so many do's and don'ts regarding hand hygiene, respiratory hygiene, respiratory etiquettes. Whenever the child wants to sneeze, we have to ask him for respiratory etiquettes. We have to teach them. We every day, in the initial days, every day we have to remind them, we have to teach them regarding the respiratory etiquettes. And again, disinfection of frequently touched areas like doorknobs and stair rails, staircases. Maintaining physical distance and hygienic practices for COVID appropriate behavior that we have already told. And they should also be aware about stigmas attached to COVID-19. So we have some patients who come and tell us that their neighbor next door people have COVID, so we don't even step out of the house. We'll get all the things like newspapers, everything out, and we'll sanitize them completely. That's because the next door people are. It's not like that. The science has proved that the fomite, yes, there is some role, but unless the COVID positive patient is close to you, that is what we measure, ask for 6 feet distance. Right? It's very close to you, and there's a chronic exposure you won't get. So there are a lot of stigmas. Even they won't look to that side. Nothing like that. If your neighbors are have affected, you have to in fact go and help them. But again, maintaining the distance. And I would tell, if you have a tightly properly fitting mask, you have very less chance of getting COVID, because the only portal of entry of COVID to our body is through our nose and mouth. So if we protect our nose and mouth, you are safe. And that is how we doctors have been working for last 2 years. Thermal screening, we are all familiar with that for fever detection. This is very important. Avoid attending school if having symptoms and seeking medical care. This is something which you have to keep on stressing again and again to parents. And it may not be just COVID-19. Any illness, you ask them to keep the child at home. It is good for him or her as well as for his friends, because it need not be, they can bring you a COVID negative certificate, but that is not enough. Any illness, because it's not just COVID-19 our problem now. We are getting lot of viral pneumonias these days. So all these people are COVID negative. So it's not just COVID. So in children, more than COVID-19, we are more scared about viral pneumonias, which we have to be giving respiratory support. We have to give them ventilatory care. It's because they get so bad. So any of the symptoms, if the child has, please don't ask him to attend the school. And they should, if they are from containment zones, they should not come to the school till the containment zone is denotified. And again, employees who are tireless, teachers or older employees, pregnant ladies, always take extra precautions when you work. Ensure the availability of medical support in the school throughout. They can have a medical team ready for that. If any emergency, they can identify a doctor and a nursing attendant, nursing staff ready, so that they can help them out. Regular health checkup, and redefine the school attendance and sick leave policies. Safe distribution of midday meal if it's being practiced in schools. Residential stay again, and safe commuting of students. Ensure continuous maintenance and monitoring. So it's just not just about starting with all these measures. You have to continue this. You have to periodically monitor the status of all this, whether it's being maintained or not continuously. And all staff and students who reach the school should be advised to continuously wear the mask, not just wearing the mask while they enter or exit the school. It's just continuously wearing the mask. They are not even they should be told that they should not even remove it while talking. So some of our patients have they have the habit of taking the mask, because it's difficult when you talk loudly with a mask. So you have to talk loudly for that you should be audible. So while talking, you should ask them not to take the mask off. It should be clearly told to all the children as well as the teachers and the staff at school. And again, not to exchange the mask with others. So recently we had a WhatsApp message, like a child went with a Chota Bheem mask and came back with a Dora mask. So that can happen in our younger friends, because they are looking at different colors and different designs of masks. They have the tendency to exchange masks. So ask them not to do that. Maybe you can write down the name at the inside surface of the mask and keep it for them. They should not share any of the materials: food, textbook, notebooks, pencils, erasers, tiffin box or water bottles, nothing. So this is against what we have taught them. We have always taught them to share things, but at least for the time being, we should ask them not to share anything till our world is safe of COVID. Windows and doors should be kept open for proper ventilation. Avoid overcrowding in all the possible areas like washrooms, corridors, lift, and all. They should be asked to sanitize hands before and after snacks. It may not be hand sanitizer always. I would always prefer to teach them washing the hands with soap and water rather than sanitizers. Sanitizers are again chemicals with more than 60% alcohol content. So it's not safe for them to use sanitizers always. Maybe for quick use you can try, but at least not for every use. You should ask them to wash with soap and water, and definitely before and after having lunch. If at all using air conditioners, again, there's a temperature setting given as 24 to 30 degrees Celsius with a relative humidity of 40 to 70% with adequate cross ventilation and fresh air. Now, the protocol of how to act when a child or or staff having suspected COVID-19 when he develops symptoms at school. So place the child in an area where he's isolated, probably a sick room. So it's ideal for every school to have a sick room with appropriate first aid events there, including a thermometer and plus or minus a pulse oximeter. If it's there, it's well and good. I isolate him for the time being, can give him a face cover or a mask until examined by a doctor. Inform the nearest medical facility as early as possible. They will undertake a risk assessment there. They will list out the contacts, how to quarantine each of them and all those. And then they will advise regarding the management of the case, contacts, and the need for disinfection. So disinfection should be performed after that. And for a suspected case in a hostel, again, may or may not be sent home. You can actually isolate him there. And all protocols should be followed as advised by Ministry of Health and Family Welfare guidelines. Now coming to role of children and parents. Yes, definitely teach them repeatedly regarding protocol, COVID appropriate behaviors. As I mentioned, just one time teaching may not be enough. We have to tell them every day, along with maybe our prayers or assembly time. We can remind them regarding this protocol till it becomes our habit, till it becomes a part of their daily habit. And it's nothing but SMS, we know. Sanitizers, as I mentioned, it's always not very safe. So open water is something which we prefer more than sanitizers. And steps of hand hygiene should be there in all school areas, especially washrooms, corridors, and all. So they can be taught. There are 10 steps by WHO regarding hand washing. At least 7 steps they should be taught. So first, all of us, all of the teachers should know about each and every step of hand hygiene, and then we'll teach them. Masks, I mentioned, we do get a lot of query about masks. What mask, how long they can wear masks in school and all those stuff. So masks, actually we get several types of masks in market. So N95, surgical mask and cloth mask, these are the major types. N95 is actually, which has a more 95% effectiveness, 95% protection against the virus. But since it's because of the same reason, it is actually, it causes more, the child will not be able to inhale and exhale so smoothly through an N95 mask. So we would advise N95 mask only for children more than 12 years. Children less than 12 years, they can either use a surgical mask. This, I think, you must have been seeing surgical mask, which we usually use in hospitals. Surgical mask or cloth mask. The children less than 6 years can always wear a cloth mask, but each cloth mask should be at least of 2 layers. So it should be a 2-layered cloth mask or a surgical mask. Less than 12 years, more than 12 years, an N95 or a surgical mask. Whatever be the type of mask, the important thing is that it should be fitting properly. It should be an adequately fitting mask. We have seen some children wearing small masks just around the over the mouth. That's not enough. So it should be adequately fitting, covering from the root of the nose till the chin. If it is too big, what happens? It will hang till here, so that here we have some vacant space, which is also not permissible. So it should be an adequately fitting mask and should be worn appropriately. So if it is, it's the one with ear tag, you can put it over the ears and should be closely fitting. Or it's an overhead mask, should be worn like this and it should be closely fitting most of the time. But one thing which I have noticed is when the kids come to our OPD, what happens is the kids will be wearing mask properly, but parents will be actually wearing it on the chin or cheek, which is not permissible. So appropriately wear it. Again, we should ask the parents to keep extra mask for them, because once it is soiled or once it is wet, it could not be used, it should be thrown out. So the reusables can be actually, if it is wet or soiled, should be kept inside the bag and taken back to the home. Or if it is not reusable, it should be thrown out. So the parents should be asked to keep at least 3 masks for a day, for a single day when they come to school. And then they should be asked not to share the mask with their friends. Do not remove while talking. They should keep it on the face itself and talk. And they should be taught about the disposal of masks as well. So that is regarding masks. On reaching back home, they should take bath. That's very important. We have kids, they have the habit of running into the home and then they'll go and sit in the lap of a grandmother. So those things where is not possible for the time being, so that they have to go directly to the bathroom, they have to get a bath, and then they can sanitize, the parents can sanitize the bag, bottles, whatever materials they have taken, carry only very few things to the school, only necessary things. And then they follow the personal hygiene and eat healthy diet. One important thing I would request you teachers to tell the parents is, whenever the child is back from school, ask them to tell about the bio bubble every day. What happened? So bio bubble, as you all know, so we have a small group, so that where it's the bio bubble is not breached. That means none of them gets infected. So you should ask them right from the beginning, in the van, in the school van, or the school during the transport at the school. Is anybody having infections? Is anybody having problems? If at all, if something like that, they have to tell the parents, and the parents have to report it immediately to teachers. So these are some small ways which we can prevent further spread, at least through the school. Again, don't ask the children and the parents not to panic, because that is not the solution. We have anyway to fight with COVID-19. So don't panic. We have to be very careful about what we are doing. We should be aware about the things which can cause problem, and then settle it. So that finishes my talk. So we will all fight together against COVID-19. So initially our motto was stay home, stay safe. Now it's slowly changing to, we are welcoming them back to school. We are going into entering the beginning of a new era. So let's see how it goes. So thank you so much for the patient listening. I'm happy to take questions now. Thank you.
Thank you, ma'am. Thank you. Anyone have any doubt or something, or any suggestions or any opinion? Anything possible? Everything welcome. Anyone?
Ma'am?
Yeah, yes.
Yeah.
Shruti, ma'am.
Yes, ma'am. Now we know the lockdown situation, all children are in home, then they can't go outside, they can't go to play with their friends like that. So how we support mentally to the children, ma'am?
Thank you, ma'am. That's actually a very valid question. As I mentioned in my talk, see, most of them, since all these kids are inside the home, they don't have much of physical illness. So I would say most of the maybe 60% of kids what we see, they have respiratory, the common respiratory problems, but none of them have developed such respiratory problems in the last 1.5 years. Maybe we started getting all these pneumonias, all these asthma exacerbations, all this running nose and things, maybe a month back only. Till that time, or maybe 2 months back, till that time, we never had such problems. So all these were, and even when we ask mothers, they'll tell, we need not go to we didn't get the chance to go to the hospital in the last 2 years because all these kids are inside. So as Shruti madam rightly said, the physical illness were actually much less, but the mental stress that they had, stress, I would say, because they were not meeting their friends, they were not getting to that the routine they had till the pre-COVID era. They were not meeting teachers, they couldn't socially interact. All these must have had a lot of issues, and most of the time the kids actually, they are I would tell my parents, because kids are more adjusting than adults. They will see, when we were asked to sit inside the home for 1 week, and then the lockdown were released from the traffic out in the road itself, we'll come to know that how eager we were to get out, how just we want to rush through the thing, and everybody were so restless why we are locked in there. But for 1.5 years they were sitting inside the home, but they just kept mum. They didn't express it, their problems. But quite often we see kids coming up with uh, a similar kind of psychological issues, especially adolescent age group. Smaller groups, yes, they have a bit of thing, but they'll somehow throw it out. They'll just run around, play with the ball. Like, but adolescent age group, this is the age where we depend a lot on our peer group. When they missed the peer group, they had a lot of issues. Um, if I'm not wrong, we had a higher incidence of even suicide rate in last 2 years. And that is why our government had come up with several programs for suicide prevention. So that too in, again, adolescent age children. So so these things, that is what exactly I had put up a couple of slides, because what they miss at school should be given at home. I know it's very difficult to completely reciprocate what is happening at school to get it back at home, but at least for so I would put it in this way. At home, parents are parents. At school, teachers are parents. So if the teachers are not there, parents have to take that responsibility also and then do it. That's why I put one slide of spending quality time with children, which most of parents don't do. Even whatever profession they come from, medical or even teaching profession, they won't spend. So even we will find somehow we'll find an hour to sit with our kids and make them do the homework, but that's not enough. And many parents tell me, I would like to, I would sit with her, I'll sit near her and make her do the homework, but that's not enough. Sit with him, sit with her for spending at least half an hour of quality time speaking to them. Half of the things will go normal when you speak to them properly and you listen to them, because they'll have a lot of things to tell. Small issues, if as you know, if you settle it in the earlier stage, it's easy to settle. If they if they keep it if they keep it uh, not disclosed for so many time so long time, that will usually come up with a problem. So that is what something I would suggest. Again, maybe now that a little bit of social networking and so in uh, socialing has started, maybe now the things will be slightly better. But for the time being, since teachers are not in
Yes.
their in their scenario, I think parents have to take it up and then do it.
Yes. Thank you, ma'am.
Thank you, Shruti ma'am. It was nice and great question from your side. And you were speaking about that speaking of kids, and the parents need to speak with the kids. So same time, it's not only about the corona I'm asking. In this pandemic time, the kids are all sitting in their home. And earlier it was the direct, they can after 2 years or 2.5 years, they are moving to the school, preschool, and then KG sessions just like. And there they are getting to speak or mingling with other kids, and the platform there to improve their speaking skills. But here, when they are sitting in their home, their papa or mama will work somewhere else, and they are not at all getting time to spend with the kids. So that speaking skills also will come down, is it?
Definitely,
So,
definitely, ma'am.
how can we means the readiness? I'm asking about the readiness, the mentally and physically readiness, and how can we give to the kids for speaking in this time, in this pandemic time? I know.
As you rightly mentioned, actually we had usually what we see is when in nuclear families, now most of us are nuclear
Yes.
families, and working parents, the parents will be busy. Even if they are working from home, they'll be busy. And most of these kids, they have a slight language delay always, and usually they come up with telling that child won't speak as when we compare with a cousin's kid who speaks a lot. So when we take the detail history, it's again the same. The child is left out with probably a gadget, child or something else, and he or she doesn't find anybody to speak or he anybody to copy. Initially the speaking skills start from copying, from imitating the words which he or she hear, right? So that is not happening. And once or twice I got children who started speaking like cartoon characters. uh, so uh, so we feel actually so bad, because it's actually what they learn to speak what they hear, and they are only left with cartoons, Dora, or similar cartoons from the in the TV or mobile. So, and they start speaking like cartoon characters or probably a similar kind of voices, and then only the parents will realize that he or she is not speaking properly. So this is something which we usually see. Maybe I would say that is one of our problems with our small nuclear families. But to some extent, when once the lockdown has started, many of the parents have moved to grandparents. So that kind of speech delays, and the siblings are together at home. So if the elder siblings speaks to the younger one again, he or she will pick up. So those kind of things which we have actually, maybe those incidents have come down, I would say. At home, if they are more trained, they'll be, I mean, they are more exposed to things. They are more, they can, I mean, talk better. Like, so developmental delay as such, we had not come up with much things, because a kid left alone at home with gadgets is not much happening nowadays. Still there, still we used to get. Finally, what they do is at the end of by 3 years, they'll end up in starting with speech therapy. So, and that is like a routine. So slowly he'll pick up. But actually, something this was something which was avoidable. That
Yes,
is what.
in some cases, under the kids, they are not getting some letters, especially ka and all.
Okay.
So what will be the reason behind
Okay, that is actually that we won't call speech delay. That is actually what we call as articulation defects.
Mhm.
So there are certain syllables. So when we divide syllables, there are certain syllables which we call as labials and buccals and all. So it depends on the part of the mouth which is used for pronouncing that syllable. Some kids may not be telling a particular type of syllable. Some kids may not be telling like ka, as you mentioned, ka. Instead of ka, they'll tell tata.
Yes, yes.
So these are actually articulation defects. Basically, they will, by practice, they will come out of it, usually by 3 to 4 years. Still, it's happening. We can give a short course of speech therapy where the trainer will train them to pronounce it in a similar way. And then maybe after a couple of months, or maybe after 6 to 8 months, he or she will learn it. I would suggest parents themselves to start doing it at home, because at that age, a preschool age, mother is the best teacher.
Yes,
So
yes.
parents,
They have to keep speaking with them. Or touching
exactly,
with them.
exactly, and never speak to the kids in what you call that kunji way. Speak to the kids in the proper way that adults speak.
Yes, yes.
So that is something which even grandparents, they do. They won't even, they will mimic the child and speak in that what you say, that kunji utla,
Yes,
which is
yes.
not which is not actually advisable. So I usually ask them again, spend 1 hour with the kid, speak to them, whichever syllables the child is not speaking, ask them to do it again and again, but don't torture them and don't make fun of them. That is also very important.
One
Especially,
of our participants sent one message to me that about how can we control the anger in kids? And so they're angry and all. Sometimes they will be very tempered.
okay. So depending on the age of getting anger, we call them by different names. So maybe less than 2 years, we call them temper tantrums. Temper tantrums is a part of normal growth. Only the problem is, if it persists beyond 2 years, we need to be cautious. And so it depends on what type of anger. I'm not sure here she meant.
Sensei ma'am? Yes, yes. And,
Yes, ma'am. Yes, ma'am. Yes, ma'am. That is, ma'am, when they are anger, when we do not get anything that they like, no, they will be anger by that. If we go outside and they saw something, and if we do not buy for that thing, they will be getting angry, very angry, and they will be sitting, lying down. They will
if
be
they're demanding some
Okay.
toys or something.
Okay, yeah, I got it. Yeah. So maybe after that, if the child is sitting down, lying down, not refusing to come up, all these slowly points towards a tantrum. So basically, management of tantrum is again, speak to them. We have two options. That is preventing tantrums, and then treating. The prevention would be a part of speaking to them. You can tell them that this is not the way you should respond. If the child is big enough, maybe 3 years plus, you can tell them this is not the way you should respond. This is not how others will respond. This is not our usual routine of doing things. If you want, if it is needed for you, I can bite you, like that. Less than 3 years, no point in telling any of these things. So what we do is, that is called timeout. So we'll first thing, we will try our maximum not to create such scenarios. If it all happened, we'll just leave them aside. Nothing will happen. So if it is temper tantrum, nothing will happen. Even if they cry for 10 minutes, 5 minutes, nothing will happen. It will just die out by itself. So that is called timeout. So that is actually
what about the hyperactive students, kids?
Hyperactive is actually a different spectrum. Hyperactivity, again, it's a part of normal development. If it is picked up around 1.5 to 3 years, more than 3 years, yes, slowly the typical ADHD spectrum starts. Hyperactivity per se can be there, or hyperactivity plus inattention can be there. All hyperactive children may not be inattentive. That is the thing. So all hyperactive children need not be branded as ADHD. Hyperactivity just can be. So they might do well at their studies. They will finish off their homework fast and then will start doing hyperactive things. So all hyperactivity is not ADHD. If there is hyperactivity along with inattention, yes, inattention is they are not able to attend. That is, their attention skills are poor. So that can be called as ADHD. ADHD again goes into several grades. Mild grade can be just again practicing them, either by parents, by making them practice, either by parents or by a psychologist, counseling session, a clinical or child psychologist. Moderate to severe, yes, we may have to start them on medications. Medications has its own goods and bads. That's the problem. So, but severe ADHDs, we have to start them on medications, and then we'll just follow up and then try to taper it down. That is what we do. Mild ADHDs, yes, by a few sessions, they will come out of it. And I would say most of the ADHDs, they will outgrow. Maybe from your experience also, mild ADHDs, usually they outgrow the thing. If it does not affect the quality of life, we'll just counsel the parents, maybe a few counseling sessions for the kids, that's all. We'll leave them alone. If it affects the quality of life, yes, we have to start them on medications.
Okay, thank you, Mama. So you are the pediatrician, that's where I asked that. Anyone else? You want to ask something? You can.
Okay, let me ask something. Was the session useful?
Yes, ma'am. It was. Yeah, superb. We got many things.
The problem with online session is I can't get the response of any of you, right? So it's like, for me, it's like a one-sided talk. I don't know even.
No, I mean, sometimes it will be interruption. So that's why only we kept muted.
Hi, ma'am. Hi.
Yeah, hi.
Hello.
Sorry, yeah. Actually, sometime before you were mentioning about the kids facing, they cannot, that clarity is not there while speaking. Actually, my son is also facing such issue that he doesn't get the letter K. He says th for everything.
Yeah, exactly.
The overall, the clarity is not there while speaking. So do you think he needs, he is going to be 6.
Okay. So I think this is a point where we can approach a speech therapist. Let them assess the speech first. Let them see what is happening to his buccals and maybe a little bit of tongue tie or something like that. Then maybe he must have to attend a few speech sessions. With that, he'll be all right. Because 6 years, it's a slightly bigger side. So I think
because because everyone said it will be okay when he grows up. So
6 years, I think it's better to assess him once and then slowly train him.
Okay, thank you so much.
Thank you, Nafia. Anyone else?
Ma'am, I have a doubt.
Yes.
It's regarding my younger child. She is 4 years now, but she is having height of 3 years and weight also same.
Because from age 1 onwards, I was facing this issue. I consulted many doctors. They said by age 4 or 5, she'll be okay. But I am little bit tensed because she is only 91 centimeter right now. Because whereas her peer group is like 100, like that, 10 centimeters less anyway. So is that any problem, or do I need to consult?
Okay. Let me ask you a few questions. What was her birth weight?
She was 3.5.
Okay. So she was a term born baby, right?
Yes,
10
yes.
months. Okay. And so here actually, the height and weight after first year depends slightly on the genetics as well as hormonal issues. So the first 1 year is basically all babies grow similarly. At the end of 1 year, all of them will universally have 10 kgs if there is no other cause for not gaining weight. Those who don't eat well will not have. Otherwise, all babies, irrespective of the birth weight, they'll grow well. But after the first year, usually the genetics and the hormonal issues set in. So first thing, regarding the height, I would advise you to check whether she falls in the range of the parental height. There is something called mid-parental height.
No,
So,
she is not actually. We checked that one.
Okay.
She is
So
not.
how small she is from the mid-parental height? You plot the chart on her growth on a growth chart?
Yes, my doctor marked something and she said that she is below average. That's what she said.
Okay. So basically what we do is we'll take the weight height of both parents. We have a calculation. You calculate it and then project it on the graph. If she is in that range, well and good. We don't have to do anything. She'll grow up. And a child will grow up only according to this mid-parental height, whatever wonder we do, because that is her height potential.
Okay.
But if she falls below the mid-parental height range, then we may have to evaluate actually. So we might have to see what exactly the problem is. Is it any hormonal issues, or is it something else? Is it just a diet problem? Maybe what exactly the thing is, we may have to work up. So the workup will again go on, like we'll have a bone age. We'll take a bone age for
bone age. I did it at age 2. Age 2, and the doctor said it's up to bone age is up to the mark, so no need to worry. And also some hormone also we did all the checkup. I met a pediatric endocrinologist, and she advised some of the hormones, and everything is in range. And she said if she is not growing 5 centimeter in a year, then I need to consult again. But at that time, maybe 2 years back, she was only 72 centimeter, but now she is 92.
Okay, so actually 2 years back, so it's actually 5 centimeters per year she is growing. That's exactly what she told us, right? So 5 is our cutoff. So anything less than 5, yes, we need to evaluate. So if it is more than 5, we'll just wait. She'll pick up.
Okay.
So since you have done the evaluation, and maybe you can repeat a bone age because it was done only at the year of 2, right?
Yes.
Now she's 6.
No, 4.
4. Okay, fine. So maybe that is something which you can do later. I would advise you to give a bit of more of proteins, add more of proteins to a diet, more of meat, milk, egg daily, pulses. So that is, proteins are the one which causes the statural growth. So that is something which you can do. And then we'll just keep her under follow-up. Anytime we feel that the height gain is less, that time we may have to require repeat the hormone test and then do it accordingly.
Okay, because she won't take this milk item, milk product she won't, but I will make her eat yogurt. Then I am worrying because of that, because when compared to my elder one, she is too small. My elder is like my elder is 10 years old and he is having height and weight of 13-year boy.
Yeah, that's a problem. So that he is also actually the other extreme.
Yes, actually he was like a 2-year above. His growth was like when he was 8, he was like a 10-year growth, like that only it was going. And when the girl comes,
so I do understand the basic cause of concern is actually comparing between 2 kids. So I would say each kid is different.
Okay.
Each kid grows differently, each kid behaves differently. So never compare, even between twins.
Mhm.
So each of them is different. So please don't do that. No medical reason to start on any hormonal treatment and all right now. So we'll
Okay.
just keep her under follow up. Every 6 monthly, it would be good to visit a pediatrician and then check her. Plot her growth on the charts. So that itself will give you a good idea how fast she's growing.
Okay. Okay. Thank you, ma'am. Because every day I'm worried because whenever I go out, her same age kids are a little bit bigger. So today also everybody was commenting that when I go out, everybody commenting she is too small. Then I was really sad.
No worries. They might have some amount of catch-up growth later also. But see, our idea is to make sure that there is no pathological issue causing the small height or small weight.
Okay.
Only that we can correct. The other one, the genetic stature and all genetics, we can't correct, right? So might be he or she might be reaching only that height, but that should be fairly well when she grows up. That is, he or she should reach a fair height when she's an adult. That's our only idea. So I think just keep follow up. If anything alarming we see, that time we'll act and maybe we'll start on her on some treatment.
Okay. Thank you.
Thank you, Henrietta, ma'am. Thank you so much. Anyone else?
Ma'am,
Hi. Yes,
Yeah.
ma'am. Shaima,
ma'am,
ma'am.
yeah, I have a doubt, ma'am. My son is going to be 3, and he says only Umma, Uppa, and all others are Ka. And for water, he asks like Pa.
Hmm.
Yeah.
Okay. Will he understand what all things we say? Every
Yes.
word?
Yeah.
Okay. If you he's presently 4 years, isn't it?
No, going to be 3 now.
3 years. Okay. Fine. So if you ask him to go to a place, get one thing, and then come back, will you do that?
Yeah, he will
Oh,
search and.
Okay, good. So actually, the comprehension is better. Only the expressive speech is slightly delayed. So that need not be, you need not worry about that much. Again, I would suggest you as a mom can sit with him, make him teach every word by word. Maybe you can set a goal of 10 words this month. By the end of November 30th, I'll teach him 10 words. A small,
Vocabulary, increasing vocabulary.
exactly. So the expressive speech is something which we have to train them. Comprehensive speech or what they understand is actually basically depending on their mentation or their intelligence. If that is there, this part we can train. It's easy. Okay.
And he started walking after 2 years. So I consulted a doctor and he told me to check the thyroid.
Okay. And then what happened?
It was normal.
Okay. He started walking only after 2 years. That is
Yeah.
slightly prolonged.
Yeah, after 2 years.
What about the calcium status and all? Is it done sometimes? Calcium and all?
Everything is okay, ma'am. Normal.
Okay, now he's perfectly all right.
Yeah.
Except for the speech.
Yeah.
Okay. So for the speech per se, this is something which what you can do. You can just train him. For the delay as such, unless a detailed evaluation might be needed if what was the cause for delay. But right now, if he is doing well, then no need to worry.
No. Okay, ma'am.
Thank you, Shaima, ma'am. Thank you so much. Ma'am, so I think can we wind up now? So already it's
So
very
this is
nice
actually a group of
session.
Montessori teachers, is it?
Yes.
Okay.
Many others also were there. Now they got disconnected. From outsiders also were there.
Okay.
Yeah.
And your schools are all set to open tomorrow?
No, it's online only.
Fine.
Yeah, online only. So it's teachers training. It's online only. And I would like to invite Henrietta ma'am for giving the thanks, the gratitude. Please express our gratitude towards Nitya doctor. It was very nice session, is it? I enjoyed a lot. And we got many information from her.
Okay. Dr. Nitya and our faculty, Mrs. Girja Peter. I would like to share my extreme thanks on behalf of this NCDC because it was a really wonderful class. Or what we are getting so much of awareness, and along with that, you cleared all our doubts. So thank you very much, ma'am. Thank you, and we again wish all the best for all your future endeavors. And also we wish again we'll meet with some other awareness classes also. Thank you so much for ma'am. I would like to thank our faculty Girja Peter for arranging such a beautiful webinar so that we were aware of so many things. Thank you, ma'am. So my hearty thanks on behalf of NCDC. Thank you.
Thank you, Vendrita ma'am. Nitya ma'am, actually, if you are not ending now, these people will come with different doubts and tensions, worries, everything.
I
We
would
will not
always
stop
love
the
to answer
webinar.
those. It's my pleasure to answer. Thank you. Thank you,
Okay,
the
so
whole
anyway,
team.
means I will forward your I will forward your contact number to them. If they have any worries about their kids or someone, they can
Fine, no issues.
contact directly to you. Okay, thank you all. Thank you so much. So I'm winding up this session for coming here, and bye bye. See you.
Thank you.
Bye bye all. Thank you. Thank you, ma'am. Once again.